morning, one and all. We'll discuss about prevalence of primary angle closure disease, assessment with Van Herrick test, gonioscopy, and ASOCT. There are two major forms of glaucoma, open angle glaucoma, angle closure glaucoma. The high prevalence of occludable angles and primary angle closure glaucoma in people of East Asian descent suggests that all the adult attending OPD for an ophthalmological assessment must have an angle assessment. Gonioscopy is the gold standard using Schoffer system. Grading system by Van Herrick's use 4-point grading system, non-invasive alternative to gonioscopy. Anterior segment OCT is based on low coherence interferometry with a superluminescent diode having a wavelength of 1310 nanometer, allows a deeper penetration and cross-sectional imaging of the anterior chamber. The study was an analytical cross-section study performed over a period of 6 months in tertiary eye hospital. A total of 200 eyes of 100 random patients who were presented to OPD were included. Consecutive patients coming to OPD, aged between 40 to 80 years were included of either gender, having spherical refraction values between -3 to +3 diopter. Exclusion criteria was patient less than 40 years and more than 80 years, having history, any patient having history of prior laser or intraocular surgery, history of prior ocular trauma, mature or hypermature cataract, with severe corneal pathology which interferes with gonioscopy, dilated pupil due to any cause, or refractive error more than 3 diopter. We have the results as our sample population we distributed, left eye 100 and right eye 100. Male was 60 and female 40 studied. Angle status with Van Herrick was found. 20 eyes were having closed angle while 180 having open angle. With gonioscopy we found 8 eyes having closed angle while 192 had open angle. With ASOCT we found 7 eyes having closed angle while 193 had open angle. Comparison of Van Herrick with gonioscopy, out of the 20 closed angle, we found 8 having closed angle on gonioscopy and 12 having open angle. While out of 180 open angle in Van Herrick, 180 all having open angle on gonioscopy. This gives the sensitivity of 100%, specificity of 93.75%, positive predictive value of 40% and negative predictive values of 100%, giving the diagnostic accuracy of 94%. Comparison of ASOCT and gonioscopy, out of the 7 closed angle, we found 4 were having closed angle on gonioscopy and 3 were having open angle. While out of 193 having open angle on ASOCT, we found 4 were having closed angle on gonio, while 189 were found having open angle. This gives the sensitivity of 50%, specificity of 98.4%, positive predictive value of 57.1%, negative predictive value of 97.9%, and diagnostic accuracy of 96.5%. Comparison of Van Herrick and ASOCT, out of 20 closed angle, we found 5 were having open angle, closed angle on ASOCT and open angle on 15. Out of 180 having open angle on Van Herrick, 2 were having closed angle on ASOCT and 178 has open angle. Gonioscopy is considered the gold standard for assessment of angle status. Sensitivity and specificity values of Van Herrick with gonioscopy as reference was found 100% and 93.75%, thus vindicating its value as a good screening test. High specificity value of 98.4% indicates that ASOCT could possibly be used as a confirmatory and diagnostic test to detect angle closure. However, screening potential of ASOCT was not proven due to low sensitivity. Angle closure glaucoma is a sight-threatening condition that can result in profound visual loss. In the early stages and in the predisposed eyes, the disease is curable now by non-invasive laser iridotomy. The prevalence of angle closure varies in different populations, thus it is very important to detect the angle closure as soon as possible. The Van Herrick method, because of its high sensitivity and high negative predictive value, can be used as a screening tool in detecting angle closure. ASOCT, on the other hand, having a high specificity, can be used to confirm angle closure. At present, gonioscopy is a mandatory tool in the evaluation of anterior chamber angle assessment, and none of the above investigations can replace it. Thank you.